into anything.
Thank you. Senator Casey.
Thank you, Chair Murray. And I want to thank the panel for being here today and for your public service at a challenging time for the country. I just wanted to make a couple of statements at the top. Assistant Secretary O'Connell, I want to ask you a question, but just wanted to note on pages 4 and 5 of your testimony about the information about the inventory that you've built up. We're happy to read that. I won't go through it all. And also the statement you made about ensuring, quote, ensuring a safe and consistent supply chain for medical materials, ingredients, and supplies is critical for any national response to public health emergencies, unquote. We couldn't be, I should say, more pleased with that kind of a focus, because we're going to need that in the future. Dr. Walensky, there was an earlier question, I think, by Senator Hassan, talking about nursing homes and nursing home workers in particular. I won't ask you a question because I've got a separate question, but the lower vaccination rate for nursing home workers is of concern. We're told by federal data that there are still 13 states where less than half of nursing home workers have been vaccinated. So the message about vaccinations couldn't be more important. And last thing I'll say, Dr. Fauci, in reference to the questions by Senator Paul today and the accusation, I think it's a widely shared view in both houses and both parties that the integrity that you bring to your work and the knowledge you bring to your work on behalf of the nation, I think that sentiment is a broad and deep reservoir, and it is very, very much bipartisan. I won't ask you to comment on that. But I have a question for Dr. Fauci and Dr. Walensky about breakthrough infections. We know that even with the great success of the vaccines, there's no 100% effectiveness. So I wanted to ask you about breakthrough infections. I haven't seen, maybe it's available, but I haven't seen information about either breakthrough infections or enough information about cases of long COVID, because I assume because of a lack of data. Dr. Walensky, I'd ask you, what types of data is CDC collecting to track breakthrough infections, and how are both CDC and the National Institutes of Allergy and Infectious Diseases, Dr. Fauci, using data to monitor outcomes in patients with breakthrough infections?
Thank you, Senator. So there are different ways that we are capturing these data, and I think all of them fit together in a puzzle. One is passive surveillance, where folks give us data when they break through. The hospital systems provide us data. They know that somebody is hospitalized and has a history of vaccination. We want to know about those cases. To the extent possible, we'd like to have a sample of the virus so that we can understand the viral load, so that we can sequence it, we can understand their symptoms and their risks that potentially put them in that situation. However, that's actually limited because it actually doesn't give us the denominator. We don't know who else would have been reporting or who we missed in that process. And in order to do real effectiveness studies, we need to have both the numerator of the cases as well as the denominator. So we're doing many of those studies across the nation. We do have them geographically sampled. We have a long-term care facility study where we're getting data from over 14,000 long-term care facilities. We have a health worker study. We have an essential worker study. That's 5,000 essential workers that are being tested by PCR every single week. And we have numerous other cohorts in 19 academic medical centers, 187 hospitals, to monitor both the numerator, how many people are breaking through, how serious is their infection, as well as the denominator, how many people overall were vaccinated, so we can get a really good window as to the breakthrough, the percentage of people who are breaking through.
Thank you. Dr. Fauci?
Yeah. Well, first, thank you very much for your prior comment, Senator. That's much appreciated. With regard to your question, I think people need to appreciate, when you talk about breakthrough infections, that the original data from the clinical trial, the efficacy data, was based on preventing clinically apparent disease, not preventing infection such as asymptomatic infection. So when you hear about a breakthrough infection, that doesn't necessarily mean the vaccine is failing, because it's still holding true, particularly with regard to protection against severe disease leading to hospitalization and deaths. So as per your question, what are we doing? We will be following for 2 years the people who are in the clinical trials, the 30,000 and 44,000 people, to be able to determine just what percent now in the context of the Delta variant are actually breaking through, to determine if it's more than that original that we saw, or in the context of Delta, if it's actually much more.
Thank you, Doctor. Thank you, Chair Murray.
Thank you.